One of my co-residents, Michaela, is from Omaha. Apparently Omaha is famous for steaks. So every year she comes back from Omaha, brings a giant cooler of steaks, and invites our entire residency class over for a steak night. And it's a really fun event that we do every year. We just had our steak night for this year like 2 weekends ago. I went to the University of Minnesota for medical school as well, and I did several orthopedic surgery rotations within the residency program while I was a med student here. And I was very impressed by the competence of the second and third year orthopedic surgery residents here. I felt like they were never questioning themselves. They knew what they were doing and just handled all of the consults with such ease. I think in terms of other things that drew me to the program, both the residency and the faculty are both very diverse. Orthopedic surgery is known to be a field that does not have a lot of women, and the orthopedic surgery residency has trained probably about 25%, a quarter of the graduates have been women, which is really impressive when the number of orthopedic surgeons nationwide is less than 10%. It's very cool to be able to have female mentors and faculty members. I think one of the biggest strengths of the program is the number of sites that we go to. We rotate at Hennepin and Regions, which are our level 1 trauma centers. And I think at those you really get your bread and butter trauma experience, learning how to reduce distal radius fractures, but at the same time, learning how to manage a complex pelvic ring injury. We rotate at the VA. It performs one of the highest number of total joint arthroplasties in the country. And we rotate at TRIA, which is an outpatient sports center. And there it's more of a private academic practice, so you're also seeing a little bit of what a more private practice setting is kind of like. We rotate at Gillette, where you're working with children with disabilities and doing limb lengthening procedures, or big pediatric scoliosis cases, or kids with hand differences. We rotate at Children's Minnesota, where you're doing bread and butter pediatric trauma. And we rotate at the university, where it's just a tertiary referral center for a lot of complex patients. Going to all these different sites gives us a lot of diversity in terms of caseload. I think it really leads to amazing and comprehensive breadth in our education. One of the things that I was worried about when I started residency was balancing work and my family. My fiance moved here from New York when I started residency for me, and I never wanted her to feel neglected because of my work. Over time, I realized that my co-residents are friends. Whenever we have a residency activity, it's always just assumed that your significant others and your partner's kids are invited. It's always just established that, yes, this is an open activity, everyone is welcome. I am almost halfway through my 4th year now and starting to look at fellowship programs and starting to look into jobs. I'm very proud to be putting that I trained at the University of Minnesota on my CV. I feel confident that I've been provided with a strong orthopedic surgery training that will help translate into being a successful orthopedic surgeon.